You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
AAPCHO's Primary Care Pipeline podcast series is a new segment highlighting careers in the Community Health Center network. Podcast interviewees discuss the advantages and rewards of working in community health centers, as well as the importance of ensuring that the community health center workforce as a whole remains viable. Dr. Grace Wang is the Chief Medical Director at the International Community Health Services Community Health Center in Seattle, Washington. In this episode, Dr. Wang speaks with AAPCHO's Director of Communications, Stacy Lavilla, about the advantages of working within the comprehensive model of care in the community health center.
So Grace, I was wondering if you could tell me why you chose a career at a community health center.
I think actually community health centers chose me, and I was really lucky to know about them before I went to medical school.
So where were you before ICHS?
I've worked in a couple of other community health centers, and I've also worked in a couple of public health departments as well.
Okay, and how is working in a community health center different from other primary care settings?
I think it has more to do with the model of care, the setting in which you work, and the patients that you take care of are probably the biggest difference.
And why would you encourage medical students to consider a career at a community health center?
Community health centers are a really good model of care for patients. In addition to having well-trained providers, we also have a team approach that uses people who have other skill sets, and with an interdisciplinary team, I think the patient's able to get really comprehensive, coordinated care that isn't necessarily available at other types of primary care practices.
And is it difficult, would you say, to recruit physicians and convince them to work within a community health center?
Yeah.
Yeah, and for what reasons would you say?
I think the notion of what it's like to work in a community health center and what it's like to be a primary care provider. We do work really hard, but I think at the end of the day, for me, what's most important is have you really made a difference by doing what you're doing, and that's a value.
Can you speak a little bit on workforce shortages? Why is it important to address this right now?
We're in a historical period in American healthcare. And if healthcare reform actually fulfills the potential that it has, it's going to be because we have a primary care workforce that is able to deliver on the promise of healthcare reform. So that's key. If we're not able to deliver on the workforce, I'm not sure how we're going to deliver on the promise of reform.
Okay. And do you have any ideas of how we can best address this shortage, like important next steps, I think, that we need to take?
Well, I think one of the pieces of healthcare reform is a role for community health centers like ICHS to be involved in the training of the future primary care workforce. And I think the earlier future primary care providers have an opportunity to learn about community health centers, the better prepared they'll be for this type of practice. And I think the attractiveness level will grow dramatically.
Okay. Does ICHS have any recruitment programs in place?
Yeah, we partner with a whole variety of training programs, mostly on a informal case-by-case basis, but I think we'd like to be involved more in a formal, ongoing training that's well supported.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.aapcho.org and tune in for our next podcast at www.aapcho.org.